again, I'll talk about 95% chance. This is about a 5% chance that the governor will allow the counties some latitude on the way they open up, back up for business. I would say that there's a 95% chance that since the governor did not allow the counties any say in closing the businesses, he will not allow the counties any say on opening the businesses. But this meeting today is about the 5% chance that if the counties are given some latitude, how we feel about opening up the businesses. So maybe one of the first things that we should do is we should listen to our health department and Dr. Aiken, and then I hope everybody has received a plan from Mesa County. Douglas County has a plan, but they're a lot bigger than us. Mesa would be closer. It's a working document, so we could let everybody chime in on that. Does that sound like a good plan, commissioners?
Yes, I'd definitely like to hear from Dr. Aiken and from our health department, and then I think a definite review and look at some other counties that are beginning to open up getting their people back into working positions and businesses opened. I sure do.
How about you, Commissioner Larry?
I would also echo the same thing. I think Dr. Aiken has sent us some good information. I'll put it in his hands to begin, and then we'll go from there and we can discuss it, because we have a lot of information and we have all the numbers in front of us too. So I'm good with that.
All right. So Dr. Aiken, you have the floor.
Well, thank you very much. I appreciate being a part of this. I'm seeing a screen that I think is Shaq's screen that has the Johns Hopkins School of Public Health Principles for a Phased Reopening Guidance for Governors. And one of the things that it mentions in there is how important it is to confer with local governments. And I would regret if you feel that the state did not confer with local governments in any part of this process, and would agree with you that we should be heard. So I think that anything that we do going forward hopefully will be part of overall decision making at the state level as well as locally. There are a number of principles that were laid out in that document that seem to be good guidance for us as we consider how we want to reopen. Things like the availability of rapid testing so that we can quickly identify who is most likely to have the infection when they have symptoms. That helps not only within the community, but particularly for hospitalized patients and patients who are in long-term care facilities who may develop symptoms. There's a strategy for testing that we have worked out, which I think once we have rapid testing available could really make it much easier to identify what's going on in our county and to try to determine the best way to manage any increase in outbreaks. Right now we don't have rapid testing capability. That is something that's nationwide. It's not just local. It's not just in the state. There are some places that have it, but many places that do not, and unfortunately we're one of those that does not. We are looking at having that capability sometime very soon, I hope. Equipment to be able to do that at the hospital lab has been on order for several weeks, and we've had great community support, including the wonderful support by the Board of County Commissioners to help with the cost of that. So I really appreciate the fact that there is a recognition for the need for testing and an understanding that it's been out of our control so far to be able to have that rapid testing available. These machines are in short supply. They are being allocated to different places across the country that have ordered them. We are supposed to be high on that allocation list, but we have not received the machine yet. When we do, we'll be able to do rapid testing, and that's going to help with following through on any plan that we may come up with. Other things that are really important are contact tracing, being able to identify who may be in contact with a positive test, a person with COVID-19, and to be able to help isolate those people from the rest of the community. As we open back up, we recognize the importance of that. I mean, I ran my own business for 15 years in this county years ago, and I know what it's like if you don't have a job or have the income. And so I'm very sympathetic to what people must be going through at this point, and I understand the urge to try to get things going again. I think that as we do that, we want to implement strategies that will allow us to be able to adequately monitor what's going on with the disease in the community, to try to continue some form of physical distancing that will help to limit the spread of the disease, to protect the people that are on the front lines, and I include people that are in long-term care facilities as being on the front lines because they're certainly the most vulnerable and they depend on caregivers to come in and meet their needs. And then to keep track of what's happening in the community so that if we see that we're getting a sudden surge of cases, that we can perhaps implement some form of restrictions again on travel and movement to avoid overwhelming the healthcare system, which can certainly happen. We've seen it happen in large cities, so you can imagine how it would be in our area, La Plata County, and elsewhere. I think it's not inappropriate to mention that there's a very big problem. I think that there's some very good workable solutions in there. We need to think about each of those, perhaps look at some of the more details in there. And again, hopefully the state would be on board if individual counties come up with good plans, and that those plans could be implemented. I would entertain questions. I have sent information out to many people who are on this call this morning that details some additional specifics of some of this. If there are questions or if other members of the health department wish to chime in, I would appreciate that at this point. Also, I think that the biggest thing about this is that we all need to come to a plan that we can all buy into. And if we're all on the same page about this and willing to support it, it's going to be really successful. So I encourage everybody to think through how we need to work on this, whatever compromises need to be made, and come up with something that everybody can be part of.
All right. Thank you, Dr. Aiken. Does anybody have any questions for the doctor?
Well, I've got a few statements I'd like to throw in if it's okay.
Go ahead, Administrator.
Okay, so first of all, I agree with you that there is a chance that the governor will not include us anymore in the reopening process than he did in the closing process. However, I think that we do have the ability to appeal, and if he doesn't include us in that process and his procedures to reopen don't make sense for our area, then we should be prepared to appeal. I think that we have a responsibility to balance the risk of increased transmission of the COVID virus against the risk to the health and well-being of the public and society and the economy. And we have to have a very balanced approach to that. So if the governor speaks this afternoon and doesn't allow for us to participate, then I think that we should ask for exemptions as they make sense with guidance from the health department. In the principles for action in the screen I have in front of you from Johns Hopkins, it says that the first thing to consider is the number of new cases declining for at least 14 days. Our highest jump was April 3rd when we went from 3 cases to 6. So that's been 17 days. The second bulletin is rapid diagnostic testing, which Dr. Aiken just spoke to, and whatever we can do to put pressure on the people that are sending that would be helpful. And I think he spoke very highly about the healthcare system's ability to care for patients and the capacity of public health to do the tracing. All of that's going to be dependent, of course, upon it's going to be dependent upon the number of cases that we have and the ability to do rapid testing. But I think there's this guidance document gives some pretty clear ways to phase in gatherings of 10, opening businesses, so long as businesses maintain the physical distancing of 6 feet or more, and provide for sanitizing and provide for cleanliness, and people are wearing masks. It allows to begin reopening. Let me switch documents here. This one is a document from Mesa County that suggests a phased approach. Phase 1, allowing gatherings of 10 people, and then encouraging telework where it's practical, but businesses that can't open with telework to practice the 6-foot distancing, encourage employees to wear masks, everybody use hand sanitizers. There's discussion about having those businesses post guidance about both employees and patrons continuing to wash hands, make sanitizer available at entrance, exits, and places where you pay. It talks about when hospitals begin elective surgeries again. I would yield to the hospital on that and let them make their own decision. I don't think it's the county's place to tell the hospital when they can and can't do elective surgeries. And then a second phase to the reopening to allow gatherings of 50 or fewer, and then a phase 3 of basically, phase 3 comes when there's either herd immunity or when there's a vaccine or some kind of cure available. Similarly, I believe Eagle County, which I seem to have lost my document here, has come up with similar guidance. So if the governor doesn't allow in his order today for county participation, I say that we appeal to CDPHE with a plan of our own that shows how we can open responsibly in a way that makes sense for Montezuma County.
Okay. Thank you. Well said, Administrator. How about Bobby Locke? Are you there for the Health Department?
Yep. I'm here. Can you hear me?
Yeah. Yes.
Okay. So I think everything that Dr. Aiken said is we totally agree with from the Health Department's perspective. I think, community-wide testing, rapid testing is critical moving forward. And the sooner we can get it here, the better. The consequence of that action obviously is going to be we will have more positives with that, and we would also have more contact tracing. So our capacity here at the Health Department, we currently have 6 nurses. I'm one of them. We have hygienists that we're going to use in this. I have 2 other nurses that we contract with we're going to use. And then we can also use our case managers and options for long-term care for this. That leaves me up to like 14 people. So at that point, we would be tipping the scales and we would need more assistance. We can request that. Karen can put in a request for additional help, but the problem is we don't really know when that would occur. So we can't really put in that request until we get closer to that need. So because I wouldn't want to request additional help and then have them sit here twiddling their thumbs. So we kind of have to wait and see how this goes, but we will definitely have more positives, which, it's a good thing because we know they're out there. We just haven't been able to test them. So, and the sooner we can find them and the sooner we can educate them and track them down, the sooner we can squash this from spreading. So testing is critical for sure. But I totally understand the balance between, business and economics and trying to get things moving. And I think Shaq's right. We have to reach that balance. What does that look like so that we can keep our community as healthy as possible? So.
All right, thank you, Bobby. I forgot to mention the hospital. Is anybody here representing the hospital? Shaq?
Well, Dr. Aiken is here.
Oh, okay, I understand. All right.
And I think there may be Bridget Jabor's on there as well, but just to mention a little bit about the elective surgeries, there's several reasons that we haven't been doing them. Certainly trying to prevent the spread of COVID-19 is part of it. Another part of it is the fact that we've had a shortage of personal protective equipment across the nation and certainly in the county, and so trying to preserve our personal protective equipment by not doing elective surgeries is another reason. There's also been a shortage of the medications that are routinely used to sedate people who need to be on ventilator therapy, and those are the same medications that are used in surgery. So there are a number of reasons that we have not been doing elective surgeries. The ability to have rapid testing would help with that too, because then we can kind of see who may or may not in our healthcare workforce have an asymptomatic case of COVID and can help to determine how safe it is to have the operating room running more routinely. And then hopefully also as production of personal protective equipment and some of these medications gets ramped up, we'd be able to go back to that. I'm not the decision maker for the hospital, but I just chime in a few of the reasons that we would have not been doing elective surgery and would need to consider these things before we started doing it again. And then once again, just from the standpoint of a surge of cases that could overwhelm, we need to be careful, we need to be ready if we see a significant increase in cases to do the things that we need to do to back away from some of the opening that we've done, not necessarily tightly restrict everything again, but at least recognize that the current restrictions are a big reason why item number 1 on that principles for action has declined well over the last 2 weeks, because we've been able to identify those cases early, do appropriate contact tracing, and limit the spread within the community.
Dr. Aiken, I don't know if you're allowed to give this number, but is there a number that the hospital has in mind that would overwhelm them?
Yeah, I think that number would be based on a couple of things. One would be staffing, how many people we actually have to be able to take care of those who might be under our care. Another is the availability of places to bed people who are ill. And a third is the critical services that might be necessary, for instance, ventilators, ICU rooms, the equipment that we need to be able to take care of the extremely ill. We have many plans in place. I know that at this point we could probably take care of at least 45 people of various severities. We couldn't take care of that many who have a critical illness on a ventilator. Our capacity there may be under half a dozen. We do partner with other healthcare facilities in the area and would certainly try to get people to a place where they could be taken care of as long as they're open beds. But, assuming that a large portion of our staff didn't become ill with COVID-19 due to a surge in cases, and unfortunately that's a precarious assumption because we've seen in other areas of the country that many healthcare workers and first responders become ill and become incapacitated for a time because of the disease. Assuming that we don't have that happen to us, we could manage, I would say, a ballpark figure of 40 patients as long as those people are not all severely ill. Some people may just be ill enough that they can't care for themselves at home, need some oxygen and nursing care that we could provide, and we have some capability for that.
That was very good information, Doctor. Thank you. How about the municipality? Anybody here on for Ted?
Sorry, Don, can I interrupt you for 1 second? This is Bobby. I got an email from the president of CalFO, and she's asking for me to find out if our county commissioners know about the webinar that's supposed to happen today with the governor at 12:15 to 12:45. You should have all gotten an invitation as county commissioners. Did you get that?
I have not gotten it, Bobby, and I'm looking at another computer sitting right here by me, and I do not have that information.
It probably would have been from a gal named Kaylin Higgins Davis. She's new to the governor's team, and apparently they sent out an invite through CCI that today 10 to 15 minutes of the model and briefing and 10 to 15 minutes of Q&A with the governor and his team, and the briefing is supposed to occur today at 12:15 to 12:45. So that's in addition to his 3:30 press conference. And apparently this is a very high-level view of what he's thinking of doing. So, you guys didn't get it?
No, I did not receive it.
Neither did I, Bobby.
I have not received it either.
Okay.
So I did receive it, and it is that meeting been canceled.
Well, see, I got that too, but this is hot off the press that it looks like they're still having it. That's what's so confusing.
Yeah.
Well,
So-
I sent us that it had been canceled because Dr. Samet, one of the speakers tomorrow, has canceled, and that it would be best.
Oh, this is today. This is for today. This webinar is today.
Yesterday. So,
Well, I don't know then. Because I just got this email from CalFO. I'll email her back and make sure that it's still on before, and if it is, then I'll forward you what I have here. So.
Bobby?
Okay, sorry to interrupt you.
Bobby, I have an additional question while you're on the phone. Well, we're speaking about reopening businesses. You know, say we are asking businesses to provide signage about don't come in if you have a fever, cough, shortness of breath, wear facial covering, sanitize your hands, gatherings of 10 or fewer initially, and then 50 or fewer. As far as being able to ensure the businesses are complying with that, do you have the staff that would be necessary to go around and just be an assistance to businesses and see how they're complying and guide them through that process?
Well, when I think about what we've been doing under a stay-at-home order, and we haven't had the capacity to even do what we're doing, and most people have been compliant. We've had a couple businesses that we've had hiccups with, and one big hiccup last Friday. And so I kind of, my inclination is to say that we would not have the capacity, because once we start allowing businesses to open, I don't see that we do have the ability to enforce that. I think that's where the personal responsibility from a business owner's perspective, they have to take on that responsibility. Once we, if we do open up and allow businesses to operate, then they need to understand that they are going to have to enforce this themselves, because we do not have the ability to police that. Now, I will say, as county commissioners, if you would like to help us with that, you could absolutely be traveling the businesses and making sure that things are being done, and just, wishing them well as they open their doors, and kind of just show support, but yet you're also supporting the social distancing piece and all the components of it to keep our community safe. So, I mean, that would help us, but I can't guarantee we're going to be able to stay on top of it, no.
So, Bobby,
go ahead.
go ahead, Commissioner.
No, that's all I had. I thought it was a great idea, what she suggested.
I think it's a fantastic idea too, and I like what you're saying about the businesses taking responsibility, because every day of the week, I would rather trust my neighbors with more freedom than my government with more power. But that being said, would you shoot me an email saying, you know, if you did need to go around and just look at businesses, you know, what kind of help Melissa might need if that was to happen, whether it's a part-time person or whatever. Will you figure out what it might take, just so I have numbers to play with if it came down to that under the governor's order, please, and thank you.
You know,
Okay, that sounds good. And well, just one last thing, we might have some folks, like for instance, our dental program, which I don't know when we're going to be able to use that, get that up and running, based on the the logistics of dental programs. They're at very high risk for COVID-19 because of the aerosol, and so I have a couple employees in the dental program that I think we could use to support Melissa. It's how do I pay for it? That's the issue. So I don't think we would necessarily need to hire somebody. I think we have some internal folks we could use to help support Melissa in that. But I can write that up in the email.
And I'd like to add into I think Bobby and Shaq at least know. I mean, we've already had some compliance issues, and my thought is having Melissa going around begging people to make their customers socially distance and those types of things is only going to have limited effectiveness, and it's likely to come down to law enforcement. I like the idea of having commissioners encourage the business owners to enforce those rules, but when they don't, and if they're conscientiously going to be flouting whatever restrictions are in place, then I think it's going to be too difficult for the health department or anybody else to enforce other than law enforcement. People sometimes listen to police officers and sheriff's deputies more than they will Melissa.
Right, it still takes us to go with them when they're ready to issue the citation. So, from my experience on Friday.
All right, thank you.
Commissioner Candelaria here, I'm going to go back to your personal responsibility piece that you spoke about. And I think that every business, realizing the situation that everybody is in here, are going to be very responsible. I mean, we're going to have some individuals that are not going to be, but we'll never cure that. The personal responsibility of the business owners, I think, it's going to lie within their hands. If we reopen and they decide not to open, that obviously is their choice, but they have that choice to make. Where we sit right now, we don't. So I think moving forward with this in the phases of the reopening is a smart plan to get ready. Dr. Aiken, I have one more question for you. As far as the staffing in the beds right now, approximately, you said, we could, if the staffing is good, we could take care of 45 people as of right now. Is that correct?
That's what our plan is, approximately 45 people. And again, that's assuming that we remain fully staffed and don't have a significant outbreak of illness among the staff.
Correct. So how many, do we have anybody in the hospital right now with COVID-19?
No, sir.
Okay, thank you.
All right, let's move on to the municipalities. Is somebody here representing Cortez? Chuck, do you have anybody from Cortez on?
I have John Doherty is on,
This is Karen
and
Sheik.
Karen
I think
Sheik is
John
on.
is on as well. John, are you there? I know he had some other things that he had to do this morning at the same time, so he may have. Oh, okay, great.
Okay, well, the floor is yours, Cortez. Go ahead.
My only question is, everything I keep reading, John Hopkins and everything else says, you can't open up until you have the testing, and we don't have the testing. So I don't understand why we're rushing this.
That's a good question.
So I think it's a matter of not us rushing it, but that we need to have a plan when the testing is here.
Okay, correct me if I'm wrong, I was just informed this morning that as of Monday, next Monday, the county's opening up again, all their buildings, is that correct?
The county will be reopening to the public, but we will be enforcing, we're installing face shields between the office workers and the customers. We are spacing the 6-foot tape and distancing. We're going to require that people wear masks, and we're providing extra hand washing and sanitizing. And some people will still be working remotely. But at this point, before the governor's speech today, the plan is to be back open to the public with tight restrictions Monday morning.
Does that answer your question, John?
Yes,
All right.
thank you.
Anything else from Cortez, Karen?
Yes, I think one of the things in Kent's letter that he outlined was that it might be helpful if the county and the local municipalities would all get together and either write separate letters just because it's more rather than less may be more impactful, but to contact the manufacturer to ask if we couldn't get this machine fast-tracked to us. If Kent feels that this would be beneficial, I think that that's something that maybe we need to get taken care of ASAP. And I am wondering also how helpful it may or may not be to get our congressional representatives to band together and with representatives from other states to apply some pressure to get the administration to ramp up the manufacturing of these tests, because it sounds like from what I'm hearing from multiple sources that without those tests, we are trying to make literally life and death decisions with not enough information.
This Commissioner Tell, and I guess I have a question. This involves Dr. Aiken as well as the hospital and public health. My understanding is Cedar Diagnostics has the capability. John Doherty brought up that we don't have the ability to test. I think at this stage of the game, there is testing availability in our county and in the Cortez community. I think the cost of that testing is where it places it into a category that may not be readily available for us to use. But am I not correct, Dr. Aiken, that Cedar Diagnostic is advertising that they can do the COVID-19 testing from somewhere between $50 and $75 with a very short turnaround time period?
Actually, Commissioner Tell, that's partly correct. They are not doing rapid testing. There's a difference between rapid testing and all of the other testing that's being done in the county right now. The rapid test results come back within a few minutes to 2 or 3 hours. The machine that the hospital has put a purchase order in for results in about 2 to 3 hours. The other tests that are being offered in the county now, including Cedar Diagnostics, are all send-away tests. And that means that we collect the samples, or Cedar Diagnostic collects the samples, and then a courier takes those samples to a reference laboratory in a large city. I think Cedar Diagnostics. Go ahead. Cedar Diagnostics is currently sending to Denver. We're sending some to Denver and also some to Kansas City to a reference lab there. The turnaround time from these send-away tests is really variable. We've had some test results come back from these reference labs within 24 to 36 hours. I've waited a week for other test results, and I'm not talking about just 4 weeks ago. I'm talking about in this last week. It's really variable. So the real key here is to be able to get this rapid turnaround testing. Cedar Diagnostics has told me, and I've worked with them quite a bit. We're in touch a lot because I think it's great to have that partnership here in the community. They are not working on getting the rapid testing at this point. So Southwest would be the place that will have the rapid testing as soon as we can get the machine. Getting back to Karen's point about contacting people, I really appreciate her bringing that up. I have no idea how long it's going to take for us to get this. Southwest has several apparent advantages to get it sooner rather than later. One advantage is that we've had a working relationship with this company for a long time. We've been considering this machine for a long time, but we didn't realize how critical it would be at the time that the COVID epidemic came out. And as soon as we realized that, the order was put in to purchase it. So we've had the purchase order in for over 3 weeks, and the people at the company have said that we are one of the few in Colorado that has asked for this machine for COVID testing, and that gives us a priority. It's impossible to fathom how these folks at the companies make the decisions to allocate the machines, but anything that we can do to possibly bring even greater attention to our need by having either as a group or individual local governments send an email or a letter to those that I referred to and the information that I sent out to many of you over the weekend can't hurt. And hopefully could be helpful. So thank you.
So, and I think that can be done, and we can all sign a joint letter to try to email and a letter to try to help them push that machine here sooner than later. Let's go to
just a second. Let me ask Kent one more question.
Sure.
In addition to having the machine, we also have to have the testing supplies as well. How many have you all made any kind of determination about how many tests we would reasonably need to be able to do in order to actually get ourselves open and going? And how realistic is it that we're going to be able to get that number?
Well, I actually think that may be doable if we can get the machine. I would have to talk a little bit more in detail with the current status with our lab director, but I believe that if we could have 1,000 tests pretty soon after we get this machine and get it up and running, it would go a long way to helping it. We'd want to test all of the people in the long-term care facilities as long as they were willing to be tested, and I think that most of them would be. That would help us to identify whether there was a disease there. We would want to test anybody who had symptoms, who was a first responder, a healthcare worker, a patient in the hospital or the emergency room. We could very quickly identify who had the COVID and who didn't. We could test, close contacts of people with the positive case if we decided that would be helpful in controlling the spread of the disease. So I think that even though I would like to have thousands of tests available here, ideally it would be just great to offer rapid testing to everybody. I think if we had 1,000 or so tests to start with and had some assurance of replenishment of those, that would be a good starting place for us. And it may be possible that we could come close to that pretty soon after we get that analyzer. We need to get the analyzer here. That's a big part of it. I'll make one other quick comment before you turn this back over to others. As far as the surge capacity at the hospital, and we've talked about 40, 45, getting to that number of people in the hospital is going to be a huge strain on all of the staff over there. So I don't think we should use that number to say, oh, well, we can handle that many people. I mean, that's really a big strain. And I hope that we never get to the point where we have to take care of that many people at once in the hospital.
All right. Thank you, Doctor. Before we go on to the next municipality, is there somebody, and we'll switch gears a little bit here, is there somebody from the Cortez Chamber of Commerce that would like to chime in?
Rocky did have to leave, so I can chime in from the Dolores Chamber of Commerce.
Well, let me go to the Dolores. I would like to tie the municipality in with the chamber. So if there's nobody from Cortez, I would like to go to Heather municipality. So Heather, if you could go, and then we'll go with that chamber, and we'll go to Dolores last. Thanks, Susan.
Hi, Commissioner Supla. I do have both my mayor and one of my trustees online, but I think at this point, we're just kind of listening and gathering information. Makis has been working on kind of a tentative plan. And one of the first steps in that plan was to have our economic development coordinator contact all of our businesses in town, starting with our nursing home, to say, what would you need? What is a concern for you? What is the most important thing? And that kind of thing. Compile that information and then kind of send out a draft plan, maybe get together with Shaq and John and Ken and talk about that. But we're kind of in the middle of planning. We don't have anything set right now. We're just starting our information gathering. And part of that is this meeting.
All right, is there anybody there from Makis, from the Chamber of Commerce, who would like to discuss the business?
We are, the Makis Chamber of Commerce is we're trying to gather information. We're working with Cortez and Dolores Chamber of Commerce as a tri-chamber right now. That way each of us can specialize and get more information out. This meeting is part of our information gathering. We want to be part of the loop, and we want to hear what the town has to say, what the county has to say, what the state has to say, and help our businesses stay supported in that manner.
All right, thank you. How about let's go to Dolores, leadership in Dolores. Would you like to chime in?
Yeah, this is Ken. Charles, can you hear me?
Yes, we can, Ken. Go ahead, Ken.
Okay. I think from Dolores' standpoint, we certainly understand the need and desire to open up parts of the economy, at least. We do share some of the concerns that Cortez expressed. I have a concern that if the county's opening strategy is different from the strategy at the state, how that's going to play out and how that will affect Dolores. For instance, I'm not sure.
Go ahead.
I'm not sure. For instance, just one example, that the town is ready to open up town hall as early as Monday, a week from today. So, those are my thoughts.
Okay, thank you, Ken. How about Susan? Chamber?
Hi. Okay, so for us at the chamber, first thing is we want to make sure that we're kept directly in the loop because we do directly represent our businesses. And we are trying to do this as a tri-chamber thing. So, I'm also looking at stuff for Cortez and Makis, and the other two chamber directors are doing that as well. So, the one thing that we can do is pull our businesses, but what we've been working on and what I've been trying to create is information to disseminate to the businesses on making sure that they're coming up with a reopening plan for themselves. So, making sure that they include in that plan the social distancing guidelines. If they have checkout counters, throwing in some facial barriers, restaurants maybe closing every other table to have the social distancing in there. Listing how many customers that they can have at any given time, the PPE requirements for their employees, and then their disinfection and sanitation plan. I was hoping from the county that they could come up with a standardized sign that we can put out to businesses to have them out on the windows, on the storefronts. I think that would be very helpful, that customers can see before they enter the building. The other thing with the reopening plan is making sure that the businesses are running through a demo and adjusting their plan if needed, and then training their employees on the plan, and then making sure that they post their plan, whatever that may be, either on their storefront and on the social media, online media, so that people coming in kind of have a clue of what to expect when the businesses do decide to open. So we want to make sure that we have the businesses as fully prepared as we can with that information and make sure that they just don't have hours that they just open. So that's what we're working on with the chamber.
Is that, so you said tri-state, so tri-chamber. Are the other two chambers working on this same plan about the sign and individual business coming up with their own plan?
Yeah, we're working on it together as well as the Montezuma Business Task Force. We had a meeting last week and tried to get some information on, what we can tell businesses as far as what they should be planning on in their reopening plan. So the Tri-Chamber, we're trying to get together just to be able to consolidate our efforts and not have to be redoing everything over and over again. So Maggie with the Mancus Chamber, she is our newsletter person, and so we're directing all of the information to her so that she can put it out to newsletters. We just uploaded 700 email addresses into her system so that she can have quick and easy contact with everybody. They did get a notice of this meeting last night. So the Cortez Chamber and me, we're kind of idea and troubleshooting and trying to get information out as far as we can to social media, through emails, through calling businesses, and also working, the biggest thing that we've been working on is getting loans out through the SBA and getting information on the EIDL and the PPP loans and doing training.
Thank you, Susan. So the objective of this meeting is to have a plan in place. If the governor gives us some latitude, which there's a very small chance that will happen. But how do we move forward as a community to get a plan that we all agree in place by the 26th or the 27th?
Oh, fuck you.
What?
Fuck you.
Jack?
No, that was not me.
Who's that?
Somebody named Betsy
that?
Harrison?
Don't mute him back, Jack. I don't know who that is. So
I muted
again,
him.
is there a way to move forward and have a plan that, so it would be individual, it would have to be individual plans. So if Dolores says they don't want to open their town hall, then they should be allowed to do that. It should be individually, but a plan that we all agree to move forward.
Larry Dodd, this is Karen Sheik. I think that both Kent and Bobby have made it pretty clear that we are not yet in a position to open up. Now, I certainly agree that there needs to be some cooperative work between the county and the municipalities to develop a plan, but to actually state at this meeting that we're going to plan on opening on the 27th, I think that's irresponsible at this point. I really do. We've got two trusted healthcare advisors that are saying that we're not ready to do that yet. So if for us to imply that we're going to, I think is not a good message to send out to our community. I think we need to pull back just a little bit.
Well, again, the governor will probably decide on the recommendations, but we need to have a plan in place so that when we do decide to open up, we have the plan.
Absolutely.
We all agree with that.
Absolutely. Yes, I agree that you do.
That is the purpose of this meeting today.
Hello, commissioners?
Yes.
Hello, can you hear me? This is the chairman for the U-Bound U-Tribe.
Oh, how you doing, Chairman Hart? Go ahead.
Can I speak?
Yes, sir. The floor is yours.
To me, I think you guys are premature in opening up the businesses. I really think this is the calm before the storm. You guys are just opening this up. What we really need to do is look at saving lives. Right now, you guys are too premature. I understand the businesses want to get back to work and their income and their finances. I understand that. But is that going to save lives by putting the businesses back open? Right now, U-Mountain U-Tribe is the largest employer in Montezuma County. We're also concerned that the neighboring states and counties, Arizona's growing at an expeditious rate. New Mexico isn't really too much, but Navajo Nation is. They're growing really fast. Once you open them businesses up, all that traffic is going to be coming this way to this city up here in Cortez, and it's going to impact the people there. Now you're saying that each business is going to regulate their own, they're going to have their own regulatory process and a plan. Are they really going to be able to do that with what staff they have? I don't think so. This rapid testing that the doctor's talking about, you guys applied for 3 weeks
ago. You haven't even received it. We applied for it, we got ours, and they told us we can only get 24 kits a week. Everybody is applying for it. You're not going to get 1,000 kits. So you got to be realistic about some of the stuff that's going on. Right now, our main concern is we need to save lives. These cases are still climbing. We're not even at our peak yet. So as the largest employer in Montezuma County, I think you guys are premature in trying to push this. And so is the governor.
All right, thank you, Chairman Hart. Again, the meeting is about formulating a plan that when the governor allows us to open. So how do we move forward with formulating the plan that all the municipalities in the county agrees with? Commissioners, you want to chime in?
Commissioner Sukla, this is Commissioner Candelaria. I think that's going to have to be between us three commissioners as the Public Health Department, along with Dr. Aiken and Bobby Locke as the director. We can outline the plan just as some of the other counties have taken in their hands, and then we will send it out for review to the cities, Mancos, Dolores, Cortez, and even to the tribal chairman, Manuel Hart. Come up with a plan. We kind of know what everybody's points of views are at this point in time. We know what the businesses want. We know what the only thing we're lacking really on phase 2 of this is the rapid testing. There again, we don't know when we're going to get that. Trust me, there's, this is, I think it's up to us at this point in time to put together the plan, and then we'll put it out for review, and we can meet again later after the governor's 3:30 meeting today, and then we can start working on that plan, and within the next 24 hours, I see no problem getting a plan put together and disseminating it for response and review by the other agencies.
I can have a draft to Dr. Aiken and Bobby Locke by close of business today, and for their input and review, because we definitely want their stamp of approval.
All right, does that sound okay to you, Commissioner Tell? You need to unmute, Commissioner Tell.
Yes, Commissioners, I do feel that is an appropriate approach to this whole issue. I think whatever we do, we have to measure it, and it has to be gauged, and it has to be staged, following what we're seeing with this illness and how this pandemic and stuff is going. I think Montezuma County has very positive numbers. I think we're in a very positive position, and I'm sure that has been brought on by the stay at home, the social distancing, and the things that are in place now. But and I'm so pleased to see that our numbers haven't grown. I'm so pleased to hear. I've talked to some people at the hospital with their emergency ambulance crews. Their calls and their runs are way down. The number of people that are coming through for the flu testing there at the hospital, the numbers are way down. So I'm just hoping that this is an indication that I don't want to say our county is unique, but I'm hoping that our county is in a position where we've got this pretty much under control at this stage, and that maybe we've seen the peak. Maybe with 13 cases and 2 fatalities, that might be our high point, and I hope that it is. And I think within the next week or 10 days, and depending on what the governor says as far as how he wishes to read the business community, that we can start moving that direction on an appropriate scale and an appropriate percentage, and do it carefully and cautiously, and again watch our numbers and make sure our infectious numbers don't go up. So I think we're on a positive path right now. I think we just have to make sure we take the right approach.
All right, well, go ahead, Ken.
Yeah, thank you very much, Commissioner Sukla. Again, I hope that we've seen the peak, and that this is the worst. But I'm an optimist, and I'm not optimistic that we've seen the peak. And we just need to be ready for that. We need to be understanding that when we start to open things up, whenever that is, we are going to see more cases, and we just need to be able to manage that appropriately. That's where we're at this point. I'm all on board with having a plan, and we just would then need to decide when to implement it, and I'm more than happy to participate in working together to get that plan. But we're going to see more cases. It's out there. It's just right across the borders, and I know that we'll just need to have a good way to be able to deal with that.
Go ahead, Queenie.
Commissioner Supla, thank you for this opportunity. I just wish that we, as this group, would have started these meetings back in March when we shut down. I feel like right now you guys are going to rush to have a plan up, and I think that we're pushing it just a little bit. MACUS has been working on their plan since March. Our staff has been doing this, and I just feel like we're rushing it right now. The tribe feels that way, the hospital feels that way, and for you guys to put a plan together without more input from the members of these people who have joined in from here, I think that's pushing it a little bit. I don't think that your plan should be drawn up and have to be accepted by all of us right now. I think we need to start more discussions on this so that we do have a concise plan in effect when we are ready. And that's just my feelings. We have too many people out there that we are responsible for, our constituents, and we have to consider them, not just our feelings. And I know the businesses, they're part of our constituents, but there's a heck of a lot more people out there too.
All right, thank you, Queenie. So anything else, commissioners? We'll go ahead and get us a plan written up. We'll have comments from the doctor, the health department, the Chamber of Commerce, the hospital, Jim, our emergency manager as well. We'll have the plan in place, and when the governor gives us a green light, if he does or doesn't, if there is any leeway for counties, then at that time, at a certain time, we will implement the plan. Does that sound like a plan?
Yeah, it does to me.
All right, anything else for the good of the order before the meeting is adjourned?
Thank you, everybody, for participating.
Oh,
Yeah.
stay safe. Thank you, everybody.
Thank you.
Yep.
Thank you.
Thank you, Commissioner.
Which audio did that FU come from?
It came from Betsy Harrison.
I love it. Which audio did that FU come from?
I don't think she realized that she wasn't muted.
Which audio? Which audio?
Mm-hmm.